Welcome, everyone. Thank you so much for joining us. I'm going to wait just a minute or two. We still have people signing in, but I can go ahead and start and kind of tee up the conversation, because what I know from having done a number of these conversations is we always have some great dialogue and learning, shared learning, and I don't want to miss any of that. So I'm Mary Minetti, the Senior Policy and Program Specialist with the Institute for Patient and Family-Centered Care. And today's informal conversation is exploring online engagement learnings. I'm joined by my colleague Ushma Patel, who has a lot of experience and helped lead us in our very first virtual international conference. So we've learned a lot about online engagement and learning, and she's going to co-facilitate with me. So welcome, Ushma. And as you know, we can't do anything without Natasha Reed, who is our technical specialist and helps us get registered and make sure that all of the things that are supposed to be working work. So be sure and let her know if you're having any problems. And Natasha, if you can put your phone number in the chat, then people have access to that if they need to reach out to you. And although we don't have her beautiful face pictured on this slide, we still have Marie Abraham, who is our illustrious chat moderator, and she is behind the scenes making sure that encouraging you to chat things in, including your name and what organization you're from, as well as helping bring to our attention if we miss some important information that you're sharing in chat, so that we can make sure that we wrap in the chat conversation into our dialogue as well. So we are asking that you fill out the poll, and I'm wondering if Natasha, you kind of moderate that. Are we ready to share it? So we have got a majority, 40% of the people on the call are patient and family advisors or long-term care advisors. That's great. Thank you. Your voice is so important in these conversations. We also have a number of coordinators. About a third of you are coordinators responsible for implementing PFCC initiatives, and often are the liaisons who build the relationship with the advisors to assist them in making meaningful contributions. We've got patient experience and patient relations personnel. And what we're noticing, especially in the hospital settings, is sometimes the roles of coordinators in PFCC and patient experience are combined or enhanced by working together. And what would we do without administrative and clinical leaders and physicians and other direct care staff, especially during this time of COVID? So we've got a good and diverse mix. And so I am so excited that you're here. So today's conversation really is about sharing what this group has said that they're interested in doing, which is sharing their information about what they're learning about the different tools and venues that they have used to connect with each other during this time of COVID, and also to learn from each other. So the polls really, we've got a couple new polls that I think you're going to find are fun. We always try to set the stage by knowing who's in the room and in what settings people are at. And although Ushma comes with all kinds of expertise related to online tools, this really is an opportunity for us to share expertise. Everybody comes with their own experiences. And so although she's going to show you a couple things, we still are going to spend the majority of our time really learning from each other, responding to the questions that people chatted in when they registered, so that we can make sure that we're talking about the things that you really are most interested in learning about. And then, of course, we always make those resources and recordings available so that you can share them with colleagues, or for those who have registered but weren't able to attend because of other demands on their time. And if you have resources and links to articles or to different information related to the dialogue, we really encourage you to share it in the chat if you can. If you're unable to do that, you're always welcome to share it with any of us individually, Natasha in particular, because she can help make sure it gets loaded into the right places at PFCC Connect. So if we want to go to the next slide, and I don't know what it's like where you are, but you can see that I have a sweater. Oregon is getting cold. We've had snow in the mountains already. It was in the high 30s when I got up this morning. although I know some of you on the east are experiencing hot weather, 70 to 80. So I know that what we have in common is that we do have the leaves change. So this poll really is around what kind of environment are you working in to partner with patients and families. And so if you take just a moment to let us know where you're working, and it may be that you check more than one, because you may be working in a hospital setting, but also the hospital may offer primary care. And so those clinics are also places where you provide input and partner. Okay, so we're almost to 90% of people who are working in hospital and medical centers are partnering in those settings. I'm always grateful to see the long-term care community and home health and other community nonprofits joining us. And my love, of course, having been a quality director, is in the ambulatory and primary care settings. So we've got really a good mix, and I think it'll make for a really wonderful conversation, because how we approach things in the hospital is not always the same in the outpatient settings, but yet we can learn from each other. So if we want to go to the next slide. So I'm going to turn this over to Ushma, who is going to, we're going to do another poll, but we're going to be given the opportunity to experience the poll in a different way. Ushma?
Thank you so much, Mary. I'm so excited to be here and joining you all for this month's informal conversation. As Mary mentioned, I helped IPFCC coordinate our first virtual conference, in 2020, which was a great success. And we got to use a lot of these virtual tools in that setting. So I wanted to get started with this discussion and kind of see what tools and platforms you all are using in your work. Some of these may be familiar to you all, some of them may be new. And we're going to actually use Mentimeter for this. So I'm going to go ahead and share my screen so that you can see Mentimeter and how that works. Great, so you can see here, there's Zoom breakout rooms, FaceTime, Prezi, Microsoft Teams, Jamboard, Slack. And you know, what I've seen is that so many people are experiencing burnout and meeting fatigue and missing, you know, the benefits of working face-to-face. And so really the need for these tools is so great. It's helping people feel more connected and more engaged in their work. So I see these dots coming in. It looks like a lot of you have used breakout rooms, Microsoft Teams. So let's give that just a couple more seconds and then we will discuss. Now, for those of you who have joined and have come to our international conference last year, you may remember that we used Zoom breakout rooms in our virtual happy hour, which was a lot of fun for people. We did a virtual Jeopardy, and it was just a great way to engage with other conference participants in a smaller setting. Okay, so I see one little dot for Slack. All right. So for those of you who have used Zoom breakout rooms and Microsoft Teams, I'm curious to hear from you all how you have shared and used this tool in your work.
Feel free to take yourselves off mute and or type into the chat.
This is Adrienne from Anne Arundel Medical Center, and we have had a lot of large sessions over time where we have, not necessarily with our PFAC, but with the hospital staff and PFAs are involved or invited, and they do the occasional Zoom breakout rooms. And it's a great concept, and we're talking about using it for our PFAC council as well. We're not exactly sure how to do it, so Ushma, I may reach out to you.
Sure. Love to
Because
help you.
yeah, we're looking at doing like a quarterly large PFA community session where we might use it. But I think the only thing people have said about the breakout rooms is they are always afraid they're missing out on something else that might be going on. But I think as long as it's coordinated right, the Zoom breakout rooms work well. I've also used it in a community health setting as well. You know, and you just have to get out of your breakout room in time so that you don't miss anything.
Well, could you tell me more about how that was used in the community health setting?
So in the community health setting, this was for a very large group planning session where they're creating a bunch of strategies for the community, for public health, all these things. And so they will do breakout rooms where you know, we are broken out into like groups of 10 or 15, and then within those breakout rooms, they're using them to get everybody to cover a topic during that session, that breakout session, and then come back and then they give feedback and summary from that breakout room.
I'm noticing that a number of people in the chat have indicated that they've used Zoom and Teams, and I'm just wondering if Cindy, you mentioned that you use both and they work great. Can you kind of share with us whether you see any differences and if there are any pros and cons from the different ways that you use those tools?
So can you hear me?
I can.
Oh, good. Okay. So I found that the Zoom for us just seems to work better. Sometimes it seems like people had trouble connecting with the Microsoft Teams, and I don't know, you know, what the technology differences are, but the Zoom breakout rooms we used for sort of a networking session where people would have their Zoom room and you could move yourself into it and actually participate in a networking session, sort of like a vendor fair. And then we also used it for training and small group work, and it worked ideally. You know, people would hop into their room for the set amount of time, then it would end and it would be reconnected, and it seemed to be pretty seamless.
Great, great. And, you know, there's been a really important question. Technology is wonderful, but Kristen raised this question. So let's share ask people to think about it and share what their experiences is, which is, how do you partner with participants to manage the technology, those that don't use Zoom and Teams every day, who may join intermittently and may be overwhelmed by the experience? How do we make that a positive experience for them and help them feel like they can manage and continue to contribute? Any ideas in the group? I bet there are a number, since we've got a lot of people with some experience. Adrian, were you going to share something? I see you.
Yeah, just for our volunteers, we always offer to help people on the side, like let them know if you have any trouble with the technology, if you're not familiar with it, please reach out to me or a select number of people, and we can help walk you through some of the technology as you're going through it.
Has anybody offered any sessions where they have, prior to the regular meeting, worked one-on-one with individuals or mentored people up with technology folks? Oh, it looks like Tammy did.
Looks like Joanna.
Okay.
She's talking about having a Zoom 101 info session early on and created some tip sheets. Great. If you'd like to chime in, Joanna, that'd be great.
Hi, it's Joanna. I'm from Toronto, Ontario. Sorry, I just don't have my camera on, pardon me. Bad hair day. Just to say that we partnered with some of our patient-family partners and created a bit of a class, a 101 Zoom early on in the COVID pandemic, which I think people felt helpful, and it was sort of a co-created class as well. And then the tip sheets, we sort of do screenshots, you know, here's where you can, the reactions, for example, you know, raise hand and how do you mute and and some things like that. Some people do use phones. And so I think it's *6 to mute or *4 to, sorry, I'm blanking on what you use to mute for a call into a Zoom, but we provide that as well. And we've had a large PFP town hall where people also are using the chat, and it was over Zoom and seemed to go quite well. And we had an option to pre-submit questions too. So if someone was having a hard time or couldn't type in the chat, but happy to hear more about what other people are doing as well.
And there's been a request by Adrian that if you have the ability to share electronically your tip sheet, we'd love to be able to see real live examples. And you can send it to any of us, or you can, if it's online, you can put the link in the chat if you'd like.
Thank you. I'll defer to my my colleague when she's back on from holiday and to find out where she saved those, and I'll definitely share what we've got.
That sounds great.
Hopefully that's helpful. Thanks.
This is all so helpful. Mary, I'm actually curious to hear from the group about Zoom fatigue. You know, are any groups experiencing that, and how are you managing any virtual fatigue that you've maybe experiencing? It's just, we've been in this kind of virtual world for 2 years, so curious to see what you all are doing.
Great question. Thoughts?
Marie actually just texted in short instructional videos that walk through using the platform are helpful too. And we actually used that for the conference. We developed a Prezi video presentation to help our presenters figure out how to use Zoom and how to record their presentation. So that was very helpful.
And Tammy, I noticed that you said that you guys actually set up test runs and helped walk people through that. Have others heard of complaints about Zoom fatigue? Looks like we got a lot going on in the chat.
Mm-hmm.
Oh, Kristen, do you want to share your strategy? And then we'll have Christine share hers.
Sure. One of the, I received from one of our, we have a co-facilitators for our patient family advisory councils that are advisors, and one of them expressed concern about kind of Zoom fatigue or just the lack of connection that you feel when you're not in person. And so I've tried to make an effort to have one-on-one phone calls with her. And then because it spreads me a little bit thin, I asked her to help with some touch bases of one-on-one to some of the other members, just so that we feel like we're staying connected, and something we're testing out. And I'm not sure if it will be a success because it lengthens the meeting a little bit. We had shortened our meetings due to COVID to an hour from an hour and a half. And so leaving a little bit of ease at the end just for informal conversation for those that wanted to stay and chat. And we all come to this with different motivations and reasons, but there are a fair number of folks that I think this is their way of feeling connected. And so there has been an interest in that type of connection. Also wondering out loud to the group if anybody is meeting in person again yet. We are still 100% virtual, but just wondering about that.
That's a great question. I see there at least one person is still 100% virtual.
Mm-hmm.
People can chat in that. Christine, do you want to talk about how you've limited your meetings and how that's worked in terms of addressing Zoom fatigue or Microsoft Teams fatigue, just the whole virtual fatigue?
Sorry, the unmute, I had to find that. Yeah, we find by limiting the meeting time, and we don't go over no matter what, it really helps that we don't get the Zoom fatigue. And sorry, I'm just getting a call on the other line. And it really helps with the Zoom fatigue, and it ensures that we're getting done what we need to, and also emailing what we need to ahead of time to be prepared to, so we're not spending as much time reviewing what we need to do. So we're still 100% virtual at this time too.
Great, thanks. Sue Collier, you mentioned that you're offering pre-work, so not everything's on screen. Can you share an example of what that might look like?
Sure. And I think the key is to kind of go back to some basic adult learning principles and to provide, for example, reading an article, maybe a short exercise, and then an open-ended question, so that as much of the screen time is truly interactive. So we're sharing, folks have had an opportunity to put their thoughts on paper in advance. And then when they come to the screen, there's not a lot of talking head or didactic instruction, and instead more communication and, frankly, more fun time together to hear what others are thinking and some of their ideas.
I noticed, Johanna,
Great.
you talked about scheduling meetings for only 50 minutes with a 10-minute break between to help people. How's that worked?
It's I think we had great intentions. I'm not sure if it's always working that way, but there was an idea we were starting a few months ago to try to have it to 50 minutes, especially even for large town halls just within our bigger department. It's an interesting concept just because people still need to have a drink of water and use the washroom, but it's very easy to just flow from one meeting to the next, and then you're all of a sudden at 3:30 in the afternoon.
Yeah, that can be brutal.
Do we want to talk about other tools, Mary? I noticed that some people have chimed in about other tools on the Mentimeter poll, or Slack, or Skype. We want to talk about some of those other tools that have been used.
Can I talk about the Slack? I was one of them.
Oh, sure. Yes,
Okay,
that'd be great.
So about 2 years ago now, I guess COVID really threw the timeline off. We started trying to find a free tool that we as a PFA community could use, and most especially for those of us who are on councils, to not bog down the email system. And I am still a huge proponent of it, but it's been kind of slow in the receiving end from everybody. I established channels on Slack, because you can establish different channels, essentially different topics, and you can invite certain people on those channels. And so you can have conversations with just select people for those specific channels. And that's what I like about Slack. But how do you engender even better feelings about Slack for a way of not bogging down your email to everybody who's still used to email? Because honestly, the email system can be overwhelming for a lot of people. And, some people just aren't even good at knowing how to reply all and all this kind of stuff. There's still people that just don't know how to use regular email the way they should, especially when they're volunteers and they're not necessarily in an email system every day. So how do you recommend convincing your group that Slack really is a great way to have conversation, not necessarily for full planning sessions? That's a difficult place to do that, but to spark ideas and bullet point conversations that you can bring up in the larger meetings later, if that makes sense. Did anyone hear that? I'm sorry, I don't know.
No, I heard
Yes.
I heard your question. I think people are just reflecting on it.
Okay.
It's only
And
about,
Natasha, sorry, go ahead, Mary.
I was going to say, since only 6% said that they had experience with Slack, it may be that we don't have someone who might comment on it. Although, Ushma, did we use Slack as part of the international conference?
We did. So we actually use this internally so that the special projects team could communicate with each other during the sessions. We found that it was, really hard to check email or even check your phone. So we always had Slack up on our laptop. And it's kind of like an IM system. As Adrienne mentioned, you can set up a channel. So let's say one channel is for a certain project. You could have another channel with, for example, the team that handled our website. So that was another channel that we had set up so that we could let them know if we had any technical issues. And it pretty much just worked like chat on your phone. And you could reply all. One thing that I did find that was helpful is setting it up in advance so that folks can practice how to use it. We also offered, training so that everyone would be on the same page and, knew when to use it, when not to use it, just so that we're not flooded with the constant IMs over and over all day. And Natasha actually just pulled up an example screenshot of what the Slack system looks like, and you can use it on your phone, and you can also use it on your laptop, like I said, in the browser.
Yeah, Ushma, that's the coolest part, is that you can get a notification on your phone and you can just use your phone.
Exactly.
Is it the same kind of notification that you might see when you have notifications turned on for email, or is it a little easier to manage?
It's a similar thing. As long as you have the app, I mean, the notification just pops up on your top part of your phone, and then you just click on it and it just heads you right to the app, just like any other application. It's really simple.
And one thing that I was reading is that, Adrienne, you kind of touched on this, but email is very formal. And this can be a really great way to just get a quick answer or a quick question that you may have to your team, and kind of have that informal dialogue that's happening a little bit, in an easier way than waiting for an email to come in.
Yeah, I mean, I think the biggest hurdle for me is that we literally have generational differences on what is easy to use and what's not. And so, I'm a Gen Xer, and I'm right in the middle. And so for me, I can do all of it, but not everybody wants to do all of it. So that's the hardest part, I think.
Yeah, reaching a balance is really important. Sue Collier's wondered if anybody's used WhatsApp. I hear that phrase, but I've never used it. Has anyone else used WhatsApp, and how does that work compared to some of these other technologies?
I've only used WhatsApp for like small conference calls. I've never used it for like a larger setting. So if Ushma knows how to put it in a large setting, I'd be curious about that too.
Yeah, I actually have never used WhatsApp, in a professional setting.
Sue, have you?
I have, but it was primarily in actually a very large conference, and it allowed you to communicate with everyone who attended the conference and completed the registration. So, but I have not used it in, for example, a 10 to 15, 20 person meeting. But if it's a group that's going to be together over a period of time, it seems it would work to allow folks to talk to each other. I guess the reason I asked that is what I liked about WhatsApp in a conference is I got to share information with who I wanted to share it with. And there was a lot of individual control over what I shared, who I shared it with. So it allowed me to develop a relationship with individuals that I may not otherwise have known.
Well, and it looks like Christine and Johanna both have used it in different settings. Do you guys want to comment on what your experience has been?
I could just jump in to say, as a conference planning committee, we all downloaded it on our laptops, and we use it as an opportunity to say, can you hear that speaker? And then I use it personally, just like Christine as well. We set up a support group for all our old university roommates. It's still ongoing.
Really?
So five of us use it, and it's been really great just as a personal support outside of work.
Well, we all need support in lots of different ways, so I appreciate you sharing.
Natasha, I'm wondering if you could go to the next slide. We have another example of a tool that I actually have not personally used, but our colleague Pam Dardis has used. It's called Jamboard. A lot of people, I think, use it in schools as well, but basically it's a digital whiteboard that allows for remote or in-person collaboration on a shared space. And so you have different drawing tools that you can use. You can use stickies. you can upload images and basically work on a whiteboard space, but virtually and online. So that may be helpful for you all that are collaborating with a team and may have a brainstorming session. So that is Jamboard.
And it looks like Kristen has mentioned that O365 is something similar with called a whiteboard.
Mm-hmm.
So.
Sue, you said that you love Jamboard. Have you used it?
I was in a conference that which the speaker used it, and I loved it. You could see the work evolve online, and you could see your input on screen. It was really a great way for you to feel involved without maybe the pressure of pulling all the ideas together. So it was a really cool tool.
Wonderful.
Linda,
Now, do you want to go to the next slide? We had several questions that were submitted from the group during registration. And just wanted to see if anyone had thoughts on these. So other tools that maybe we have not mentioned so far, any other recommended apps that people can use on their phones?
I noticed that someone in the chat way at the early stage talked about Trello and Google Slides, which I was not familiar with Trello in particular. I can't remember who that was, but if you want to share anything about that particular app, it might be useful.
Sure, it's Joanna again. Sorry, I'm a little
okay.
chatty
No,
today.
That's okay.
I wish my colleague, there's one of my colleagues already on this call, which is great. And there's another of my colleagues who's just on holiday this week, but she introduced us to Trello recently, which you can add, I guess, buckets. And so one of it is, this is a brainstorming bucket. And you could just add a card, and then the whole team can look at it at the same time. So if you're using it for your patient family council, maybe there's a couple of cards where you want to use education, and people just drag in education resources or something. In the case that we're trying it now is we're using brainstorming. So things that you're thinking about, things that you're getting ready to get started on a project, things that you're doing, and then things that you've completed, and you can drag it in between. And it's just really neat. And in terms of Google Slides, I'm just looking at your Jamboard now, which I'm super excited about. It's similar, but you can make your PowerPoint slides. I believe you can bring them into a Google slide, and then you can share it as a common link and have people work interactively and collaboratively on slides. You can use sticky notes and voting dots, shared timelines. Yeah, sorry, I'm going to mute now for sure.
No, this is so helpful. Please don't mute.
We appreciate your contribution. Linda Starnes, you have used both Jamboard and Teams Whiteboard. Can you kind of describe how you've used them and what their differences are for those of us that might not have experienced either?
Sure. Hi, this is Linda Starnes from Orlando, and I work with our Title V Children and Youth with Special Healthcare Needs office, as well as I'm on a variety of different boards related to disability and healthcare. And I've used them at conferences, at board meetings, and in work meetings. And I can say, first of all, they're wonderful tools, very similar, and create a nice in the moment collaborative, and it can be saved and updated along the way after the meeting ends. But what we have found is you really do need to have a pre-training, if at all possible, for participants before you just dive in and start using it at a meeting, because of those different levels that we were just hearing about of skill sets and technology. It really is much more robust when everybody feels comfortable and familiar with it. So if you feel like you want to use these tools in a meeting, just try to have a great quickie on how-tos before you use it formally in a meeting.
Great. It is important to think ahead in your planning when you're looking at utilizing these kinds of tools, so that you can leverage the best of what the tool has to offer.
Kristen has a question into the group. Has anyone experienced problems with underserved communities not having the right access to tools, tablets, internet service? We are working to include more diversity. That's a great question. Has anyone else experienced this as well?
I can, while people are thinking, I can share something that I learned. I think I read an article, but there was a rural area that had a clinic, and the bandwidth and the internet service was not good out in that rural community. And what they did is they, during COVID, and they may still be doing it, is they brought, they boosted their Wi-Fi signal within their clinic, and then they set up appointments with people, and people came in and parked in the parking lot and utilized the internet service that the clinic had in order to be able to do their telehealth visits, which I thought was a creative way to do it, because they weren't going to be able to, you know, run cable and get that internet service out into those communities.
And that's a great idea. And I just want to be clear, I maybe asked the question in an impertinent way, more of we're trying to task ourselves with thing of, we know who we've included traditionally or who is drawn to be on our councils. And we just want to task ourselves with, like, how do we become more open to maybe who's not traditionally there, who's not accessing services. So I'm maybe asking more of an aspirational question than anything. And so I've just been trying to think, like, okay, how would I make it? So I love your idea of, you know, at a hospital or a center, maybe a community center might be another place that could make things accessible. So again, pardon me with the group if that felt like an impertinent question. It's more of just trying to think, as we think with more of a diversity, equity, inclusion lens, how to make that actionable. And I just know there are a lot of people that are a lot smarter than I am probably on this call.
It's an important question, and it's very pertinent to all of us in terms of equity and inclusion. And the more robust feedback we can get from a variety of populations is really important. I know that we have a number of resources on our website about how to recruit for diversity and the importance of connecting with community leaders representing different diverse populations to build trust and relationship, and have them help broker the building of a relationship with the population that they really are leaders in, to increase diversity and to go out to where people are, I mean, literally, and build those relationships. But that's more, you know, general and not just with technology. And Marie, you've got some important comments, and I'm wondering if you want to share.
Mary,
Yes.
I am going to have background noise. But Ushma and I are actually working on a project with communities from 2 urban cities that we're actually working with communities from the poorest neighborhoods. And what we've found is that if the community organization that we're working with do support everyone to be involved, most people we find use their phones, and they're quite, when we have Zoom meetings, they're often doing it on their phone or their tablets, but they do support them. They give them instructions if they need it. They provide them tablets. They provide the data plans, whatever they need, getting those kinds of resources into the hands of people are so important, and we wouldn't be able to do the project without that.
Good points. Linda, you had a significant message in chat as well related to outreach and being creative. You want to share some strategies and tips?
Well, I've been in a lot of state and national conversations. Again, this is the dilemma with our telehealth services, in how we reach those populations and support them. And so, we're doing a variety of ways as well. And the big one is that mentoring piece of having a peer mentor who is a part of the board or a part of the PFAC or whatever to come alongside the newer members or those that have outreach, and just making sure that they are comfortable with whatever platform is being used for meetings, and also kind of troubleshooting through that. And that's what we have found as best, is that one-to-one conversations to figure out and meet them where they are, and go from there and use resources from there once you know where they are in the process of connectivity.
Great. Thanks for sharing. I'm noticing the time is slipping away, and we have some other questions that people raised. I'm wondering if we want to move on and take a look at
Yeah, that sounds like a great idea. This was actually a quote that I read in an Associations Now article that it was just so pertinent. In this world that we have so many more tools, but it's more than just using the tools. And this was the quote: teams must be far more intentional with how and when they engage with one another. So using those tools in a way that you can feel connected, and kind of fill that void of that in-person gathering. It looks like. Go ahead.
Oh, I was just going to say, it's a good reminder. I think about all the meetings with PFACs that I've held over the years, and we often would end meetings with what worked well and what didn't work so well. And I wonder if some of those routines that really helped us gather in an ongoing way feedback about the experience of the meetings and the building of the relationships is something that has kind of fallen by the wayside. And if we can reinstitute, even within the virtual world, the opportunity to focus on that, it's about the relationship. Technology helps facilitate that when we get physically together. But how is it we build those relationships, that sense of cohesion, that appreciation for the diverse voices, but also that sense of we're in this together, and we have common goals for the purpose of our meeting, however that meeting is, whether it's face-to-face or virtual. So here are some of the general questions that people have raised during the registration process, and we have touched on a number of them in terms of what's worked well, but we want to just offer the opportunity for those who haven't been able to contribute or break in. Is there something in particular that's worked particularly well, even not just in terms of the technology, but in terms of the process that has supported the development of relationships? And what are some of the challenges that you've had to address so that you maintain and strengthen and enhance those relationships in working toward common purpose? So I'm going to just open it up and see what people might have to share about their insights.
Hi, this is Sonia from Hackensack Meridian Health. How's everyone?
Good. Thank you, Sonia.
Thanks for joining.
Oh, you're welcome. So I think that some of the challenges is that our advisory councils, we have 9. We have 9 network sites, so we have 9 advisory councils. So I'm the coordinator for the network, so I kind of facilitate these councils. And what I've been hearing is that they sound, now that we've gone virtual for now a year and a half, they sound more like a sounding board. We bring speakers in to talk to them and to bring information, but they're really not being engaged. So what we're asking of our leaders now is to come and ask for feedback. Let's do walking in the shoes, right? Let's invite our advisory council members, those that have met the criteria, because we do have a criteria that they have to meet now to be on site, to come and do virtual tours, right? Let us know, let them see virtually how we're doing and where areas where we need to improve.
Mm-hmm.
So I think our advisors, you know, they do have burnout, Zoom burnout, or whatever other platform burnout. I think they want to be more hands-on and boots on the ground. And I know that has been difficult with COVID. So we're constantly trying to come up with ideas and how we can get them more engaged.
Mm-hmm. What kind of criteria have you created in order to invite them to be more physically involved?
So we do ask our volunteers when they join that they become volunteers. So they do have to go through the volunteer process. I know a lot of other facilities don't require that, but if they go through the volunteer process, which consists of an application, a background check, as well as medical requirements, which include certain vaccines, they're able to come on site as needed.
Great, great. I think it's really a good point that you make about have these virtual settings really stifled the ability for that exchange that's back and forth, where the advisors are really meaningfully providing input and influencing changes and decisions about operations and things. What are other people? Thank you so much for sharing, Sonia. What are other people doing?
Like Adrienne has her hand up, Mary.
Oh,
Well,
Adrienne.
I did have we were doing a lot of things, but I did have a follow-up for Sonia on how they're doing virtual tours, because we have talked about that as a PFA community. You know, we feel, you know, there's still so many PFAs that we're just not on campus all this time. And, you know, there's a disconnect. If you're not there, some of our PFAs have come on board in the past year and a half and really haven't had a chance to wet their whistle whatsoever. So how are you engaging these virtual tours? Is it your volunteers that are doing them, or are those staff? Because, you know, we have staffing issues, as does everyone else. And you can't exactly ask nurses right now to do virtual tours. So can you explain more about the virtual tour? Because that's
Sure.
a component I think that would be very helpful.
Sure. Now that COVID has picked up again, you know, they have slowed down. But before we were doing in-person virtual tours, again, that they meet the requirement that they become a volunteer. They were also doing bedside tours with our Office of Patient Experience Leaders via an iPad. So they weren't being done as a team, they were done on an individual basis. That means if an advisor was interested in doing rounding with one of our patient experience advisors, we would get them connected on the iPad, and then they would go round with our patient experience leader.
Oh, that's a cool idea. If only we just haven't opened up our hospital like that this whole time, but rounding, that's a really great idea.
Great, thank you. I'm gonna have us, Natasha, go to the next slide, because I want to give people the opportunity to see one more Mentimeter thing. So are there any questions on this particular slide that people want to really quickly respond to? We talked a little bit about how people have addressed diversity. And have any of you seen that the virtual options have helped you grow and recruit people to your PFAC that wouldn't have otherwise been able to participate? I know that some communities have said because people are home with their children, that childcare was an issue, and so being able to have virtual opportunities for participating were parents of young kids often were able to participate.
I think it works in the matter that people who work can join later meetings throughout the day. So I think that kind of worked for us in a sense.
Great, great. So any tips or tricks that people want to share about virtual facilitation? I know that there was a link that was shared by Johanna related. It was called the Remote Facilitators Pocket Guide. Is that something that you've used, Johanna?
Yes, I don't leave home without it. Let's just say that it's been an amazing eye opener for me. And it's, I think this book was written in 2020, but before, I guess, COVID, in terms of it went to publish before. And since then, they, of course, have had to expand their company. So they're an amazing group of people, I think, anyway. And they have courses and classes. And I've been able to talk to my team about it as well. And I've read the book. And for me, it's been a real eye opener. Not as familiar with some of the technology initially. It's been very helpful. Oh, there's someone else coming in with another tip. Oh, thanks, Ushma, that's great. I'll look at that as well. It's been very helpful. So our library scientist linked me with this group who wrote this book, and since then I've never looked back.
Well, that's a great resource, and we appreciate you sharing it. Any other resources that individuals have that has really helped them enhance and strengthen their virtual facilitation?
Mary, I was going to say the time that you hold the virtual sessions is key. And we have found that there seems to be a sweet spot for, especially if we're engaging staff who've already been at their day job at the hospital, 5:30 to 6:30 seems to be a sweet spot where we can get a lot of people to join. And we have a lot of PFAs who work during the day full time. So I think number one is finding the right time of day. A lot of people can do lunchtime, they can do morning, but we have found that 5:30 to 6:30 timeframe seems to be a really good time that people can join. So, but we're filling up the week constantly now with that time. So it's getting to be very tricky.
Yeah, there's only so many weeks or days in a week.
Yes, yes.
With that time frame. But that's a great, very practical tool. So thank you for sharing it, Adrienne. Other tips and tools that people want to share?
Mary, I was thinking about, what we do internally at IPFCC to kind of build our relationship with each other as colleagues that may apply to other settings as well. So, we have a monthly staff meeting for an hour, but before that actual formal staff meeting with an agenda, we meet for a half an hour to just check in with each other, hang out. Mary will often pose a reflective question to the group, and we'll share pictures or stories, kind of what's going on in your world personally and professionally. And it's a great way to just connect with your colleagues and find out how everyone's doing in this remote world. So that could also apply to, PFAC meetings or other group meetings that you may have in a hospital or healthcare setting.
Great. Well, we've had a lot of fun with it. I know that.
We have.
I know that the Pacific Business Group on Health, when they are working in their virtual collaboratives, they are fairly clear about taking breaks, and they also have stretch breaks, and they share recipes at the beginning with each other, and just do things that really make connections on a personal level that can help build that relationship and can make a big difference. Any other comments that people want to make related to these questions? I don't know if anyone has nurse navigators and how their jobs have changed in the virtual environment. That may not be something that is happening everywhere, but that was an issue for at least one person who registered. Well, then I think given the time frame, Ushma, I'm wondering if we want to go and have the opportunity to use Mentimeter, but in a different way.
Yeah, no, let's go ahead and I'm going to go ahead and share my screen again, but we're going to be using the same code that we used earlier in the meeting. So either on your phone or on your browser, you'll just need to go to menti.com and put in that code. And we're going to actually create our own meeting word cloud. Can everyone see my screen?
Mm-hmm.
Okay, perfect. I see the words are coming in. A lot of people have put in useful. There's some overwhelming, challenging. That, yep, that sure is. Engaged, friendly. And so with these word clouds, you know, the more people that put in those words, it becomes bigger. So you can kind of see the common themes that show up. Trial by fire. Roller coaster. That's a great way to describe it.
Ushma, could you just comment on the getting a Menti account? There's been a question about that.
Sure. So I believe there is a monthly fee for this, but you can also use some of the tools for free. I don't know the exact price off the top of my head, but I can look that up and let you all know.
It's kind of cool the way it keeps changing.
And the actually for Mentimeter, the other cool thing about it is that you can actually load your slides into the software. And so right now, you know how Natasha's sharing her slides, but then we have to go to the Mentimeter screen. So another way is to actually load your entire slide deck into the tool. And that just makes it very easy. It just flows smoothly throughout the presentation.
Okay. Well, I'm going to submit one more word and then I'm going to shift gears because I'm noticing it's 2 minutes before the end of the time. So if we can go kind of finish up here. Now, I'm going to ask one question. Can you save that word cloud if you wanted to share it with somebody? Is that a possible? I mean, I know it's gone now, but in terms of software.
Yes, you can definitely save it as, you know, a JPEG or a PDF and then share it with participants after.
Great, great. Well, we have come to the conclusion of another very useful and inspiring and learning-filled PFCC Connect conversation. For those of you that aren't aware, we do have a place on our website where we put a lot of our COVID-19 information, and certainly that has been important, and we've drawn it from these conversations and from our contacts across the field so that we can continue to promote partnerships across the continuum and with a diverse and important voices of our patients and our families. So if you haven't been to that website, we encourage you to do that. We're always loading new content. The next slide, please, Natasha. If you aren't a member of PFCC Connect, please join. And if you know of others that would like to join, it is our free online learning community, and we can continue the conversation by using discussion posts and continuing to share information. We will share the relevant links, and we're going to go to the next slide so that I can share what it looks like. If you haven't gone into PFCC Connect to the library, there's a list of folders when you go to the library, and you click on COVID and it lists all the different conversations that we've had. So if you've missed any of our conversations and you want to catch some of the resources and the ideas from other people, and you missed it live, you can always catch it on the recorded version. Next slide, please. So we learn from you every time we do these conversations. And one of the ways we learn from you is if you take the time to fill out our evaluation. And the last question is, are there other things that you want to talk about in this format so that we can have shared learning? And so we really, the reason we had this conversation today is because of the feedback that we got in the last couple conversations. So we really encourage you to take a moment to help us create the kinds of conversations that are meaningful for you, that are useful and helpful as you continue to build partnerships in the virtual world. And hopefully it'll be a face-to-face world, and probably a mix as the future unfolds. We hope that you take the time to have a great day. And thank you so much for joining us. And Ushma, thanks for sharing all this technology and kind of
Thank you.
teeing
It's
up
my
this
pleasure.
conversation. It's been great. Take care, everyone. Bye.
Take care. Thank you.